Today we have Dr. Jay Sanguinetti with us, and he's going to be talking about how practicing mindfulness changes your brain and your body. What we know so far, that's the title of the talk. And Dr. Sanguinetti, just scroll here really quick. Dr. Sanguinetti is an adjunct professor at the University of Arizona and research assistant professor at the University of New Mexico, and assistant director at the Center for Consciousness Studies in Tucson. He's trained in philosophy, neuroscience, and cognitive psychology. Dr. Sanguinetti has published widely from topics in the neural basis of vision and the temporal dynamics of perception to understanding how the brain changes in Parkinson's disease and schizophrenia. His current interests include using non-invasive brain stimulation to enhance cognition and well-being. Jay is presently investigating whether focused ultrasound neuromodulation can augment mindfulness practice in collaboration with Shinzen Young. They recently launched the Sonification Enhanced Mindfulness Awareness Lab at the University of Arizona. And so we welcome Dr. Jay Sanguinetti today. He'll be leading us on a meditation today, besides doing a small talk. And the talk will be quite interactive, so you can post your questions on the chat, but you can also raise your hand if you have questions on the participant window. There's a little icon at the bottom of your screen. It looks like small little figures. And you can just click on that. That would open up a window. And you can raise your hand there. And you can also, if you're on an iPad, it will be on the upper right-hand corner, I believe. So, so you can raise your hand there, or you can post them on the chat as well. The chat is open for us to kind of share our questions or our reflections. The only time the chat will be closed will be during the meditation. So I will disable the chat just for a little bit. And just to let you know, this is being recorded. And now this time the entire session is going to be recorded. I know often we only record the meditation, but this time any questions that you might have will be recorded as well. So just so that you know, this will be streamed, this will be recorded, because many of us can access the time right now and they have asked me to record it for them. So this will be posted. So I thank you all for being here. I thank Dr. Sanguinetti for being here. He will be starting with sampling of a mindfulness practice developed by Shinzen Young. And then we will hold a conversation about the current state of the science and the emerging understanding of how mindfulness impacts our brains and our bodies. And also discuss the potential negative impacts of mindfulness training and how science can contextualize these effects. So welcome, Dr. Sanguinetti. I want to pass it on to you. Thank you for being with us today.
All right, well, thank you so much for the invitation, Alex. And it's so great to see so many people there. I've got you organized on my screen as a bunch of little boxes with faces. So my heart is warm to see so many people here and to see the great chat going on the right here. I'm teaching online, currently 120 students, and usually my chats are, this is boring and whatever. And, you know, so to see the beautiful messages of my heart is full of joy, this is a good break for me. So it's very great to be here. And I'm very excited to get to share some of the research that I'm doing with Shinzen Young here in Tucson, Arizona. And generally just to talk about the effects of mindfulness on the brain and behavior. But we thought it would be fun to first start with a little sampling of a meditation practice that Shinzen Young has developed over the past 30 years that I think will give you a good sense of the way that we're thinking about mindfulness. So this is a bit of a teaching and a bit of a setup for the talk later. So I think we'll probably do about 10 to 15 minutes. Is that a good amount of time? Okay, great. So let me set the clock here. So this is a practice that Shinzen calls see, hear, feel. It's a very simple practice that can become very complicated quickly. And so if you've tried it before, I'm going to give you the very simple version. And if you like it, I would encourage you to go look on YouTube or on any of the meditation apps on the phone, and you can find Shinzen or some of Shinzen's students teaching these techniques. One thing I really like about this, and one thing that we are really promoting in the lab, is teaching mindfulness skills that you can do in daily life. So this is a practice that you don't have to close your eyes and sit on a pillow to do. And part of the research in the lab is finding meditation skills that translate outside of the lab, or outside or off of the pillow. And that's really the very long-term effects that we're looking for. So this practice can be done with eyes open or eyes closed. You can do it while you're driving your car or talking to your children. And of course, you can do it while you're sitting on the pillow. So today we will start by sitting. And we're going to start with our eyes closed, if you don't mind. So go ahead and settle into your chair and close your eyes. And try to stretch your back up a bit, get comfortable, and find a nice sitting position. And I like to tell people to think about if there was a string coming from the top of your head, if you just pull it on that string a little bit, just to get your back nice and straight. Now during this practice, it's important to try to sit still, but if you get uncomfortable, it's totally okay to move. And get yourself back into a comfortable but upright position. And then bring your attention into your body and just subtly notice any sensations that you have in your body. And wherever those sensations are, just allow them to occur. Check in with your body and allow it to be comfortable. Now, with your eyes closed, you may notice that there's a subtle color, changing light. Maybe the sunlight is coming through your window and you're seeing some light. Or you may be having a visual thought. Since I said sunlight, you may have imagined the sun. Any of these sensations are visual thoughts or visual sensations. And when you have those, we're going to call that see. S-E-E, you're seeing. Now, as you're paying attention, you may notice that there are some sounds. Obviously, my voice is a sound. You may hear some noises outside. Car may be driving by. And you also may notice a little voice in your head, or you may have an auditory thought. So any of these we're going to call hear. You can hear the thoughts in your head, and you can hear the sounds outside. And if you bring your attention back into your body, you'll probably notice some subtle sensations of your clothes touching your skin. You may notice your feet touching the ground. And you may even have an emotional experience. You may have a moment of release where you relax, or you might be feeling a little discomfort. So any of these body sensations we're going to call feel, including any emotional experience that you're having. So we can have a visual sensation, we call that see. We can have an auditory sensation, we'll call that hear. And we can have physical and body sensations, which we call feel. Now, for our initial focus range, I want you to just leave it unrestricted. So that means don't focus on any one of these modalities, see, hear, or feel. But instead, your contact strategy is just to be passive. Just openly monitor. Anytime you have a visual thought, you'll say see. Anytime you hear that little voice in your head, you'll say hear. Or if you have an emotion or a body sensation, you'll say feel. And what you want to do is just lay back, sit back, and allow your sensory experiences to come to you. Now, if nothing is active, then you're going to call that rest. So if you hear a sound outside, you say hear. And then if everything is quiet and you don't notice any sensations, you just want to call that rest. Your head can be quiet, your mind can be blank. You can see visual rest where there's no visual sensations. You can hear rest and you can feel rest. So just sit back, notice your sensations and label them as see, hear, or feel. And enjoy that it's a simple task. And as you do this, try to stay awake. If you notice that you're getting sleepy, just stretch your back a little bit. Keep your posture upright and come back to the practice. Now, you may notice that you're drawn to one of these sensory modalities. For example, you may be drawn to visual. And that's okay. These sensations may hold your attention, and that's fine. Just focus on it for as long as you need to. However, you may also notice that these sensations instantly vanish as soon as you label them. That's also okay. That's impermanence. Just bring your attention back and label the next experience. If you're drawn to multiple sensations at the same time, it's also okay. What you want to do is just pick one. It doesn't matter. Label that one, and then let it vanish. So as you're doing this practice, you might become aware of more detail in each modality. So for example, in the auditory stream, you might notice restful states. You might notice that the auditory information is just flowing. There's lots of different subcategories. And you might notice that there's a lot of precision and detail. The size, the shape, the temporal nature, even how big or small the event is. And if you're drawn to any of these details, that's okay. You're looking at the detail or the resolution of the sensation. You might also be drawn in the opposite direction, a loss of interest in the details and disintegration of the experience. In this case, everything may be falling into a flow between the spaces of your sensations. For example, you may perceive a flowing space between visual and auditory perception. In this case, the water is just sloshing around, and you're realizing that in reality it's all just one space, one open water. That's okay too. And you may not be drawn to either of these. You may simply be implementing the procedure, which is totally fine. In any of these cases, the technique is the same. All you want to do is focus on auditory, visual, or somatic perception and label it. And when you're ready, bring your attention back into your body. And just notice again any of the sensations. And then you can slowly open your eyes. And come back to the group. Hello, everybody. So Alex, do we want to take a minute to let people report anything, or do we want to go right into the talk?
I think we can probably go on into the talk and then just have it conversation style for everybody to just, if you like to raise your hand on the participants window, then just raise your hand on the participants window. And if you like to post a question on the chat, you can do that too, and we'll all keep an eye on everything. So yeah, so this is your space, and we're kind of just going along with whatever you like, Jay. So.
Sure, sounds good. Well, maybe after the talk, if you want to report anything that happened, I'd love to hear it. Most of my methods involve neuroimaging, so MRI and EEG, but I love self-report. So I'd love to hear what that was like for you. Okay, so I will share my screen. And can you see this? Yep. Okay, great. So I'm very pleased to talk about mindfulness today. I have made the transition in my own research career to studying mindfulness full time only about a year ago. And now I get to talk about mindfulness. I get to do mindfulness. I get to teach mindfulness. My whole life is becoming about this, and it seems like exactly the right thing to be doing. So very happy to be here talking to you about this research today. So how many people know what this word means or have ever seen this word? Somebody can raise their hand if they've seen it. So the term is nomophobia. You can get the nomo piece, no more, maybe is what it sounds like. Actually, what it means is the fear of being without your mobile phone. No mobile phone phobia. It's hard to get that from the etymology of that word, but it's actually a new disorder that is being diagnosed by clinical psychology in the Western world. And it is a growing problem in the United States, at least. When you look at the nomophobia questionnaire and you actually ask people under the age of 50, sorry about that, under the age of 50, if they classify for this disorder, almost 66% of people actually can be diagnosed with this. And 41% of the responders actually say they have 2 or more cell phones just in case one of them breaks, which is pretty amazing since they're so expensive. A basic diagnosis of this means that if you are without your phone for any significant amount of time, meaning more than 30 seconds, that it creates panic and anxiety in you, that you exhibit behaviors of seeking, sort of like an addict, and that you can't focus on any other tasks, including driving a car, feeding your children, or working, until you have located your cellular phone. So in this literature, if you start digging through it, it's pretty fascinating. 60% of people under the age of 40 actually say that they text and drive on a regular basis, meaning 4 times a week. And then if you ask them if they think this is a problem, almost everybody says yes. 57% actually are trying to reduce their cell phone behavior with not much success, I think. And so what is happening here? Why is it that we have a situation where we know that this is a problem? We know that it's causing a problem in our lives. And it says the host is spotlighted my video. Can you see my screen? Yeah, okay. So why are we in this situation where we're using these phones? We know they're a problem, but we can't stop our behavior. Well, Judd Brewer, one of the mindfulness researchers, has come up with this really beautiful model in this paper in 2015. The basic idea is that you have a sensory input, it goes into the brain, then you either associate that input with positive emotions. So for example, let's say I get a text from my new girlfriend and that makes me feel good. So now I'm associating a positive emotion. That causes me to crave that input. I want to know what my girlfriend is saying all the time now. Then I check my phone. I get more positive affect because she tells me she likes my haircut. Now I'm associating that phone with positive emotions. And the phone is very good at causing these positive associations. This also occurs for negative associations. So now I've had a rough day at work and I just want that negative emotion to go away. And so what I do is I pick up the phone, look at the text from my girlfriend. She says something nice that removes my negative emotion. And again, I get an association. So this system in the brain, this is called the habit formation system, is very old, millions and millions of years old. It's based on dopamine, and dopamine is a very strong neurochemical, and it works very quickly. You need to be able to learn the associations between stimuli and response very quickly to survive. So in a sense, the situation that we're in with cell phones is that they're hijacking our learning system such that the behaviors that we exhibit become unconscious or implicit. And that causes a situation where we even may consciously know, I can say to myself, don't use my phone while you drive, stupid. And then I'm sitting there driving and I'm using my phone. That's an unconscious implicit behavior. So we can call these habits. These are incrementally acquired patterns of thinking, feeling, and perceiving. And habits are what help us survive. We need habits, they're a very good thing. But in the mindfulness and attention literature, what tends to emerge is that habits can bias your attention. So that's the basic idea. Through forming these habits, my attention becomes biased. So let's take the example of driving a car. So I know consciously that I should not pick up my phone when my girlfriend texts. Okay, I can say that to myself. I can write it on the window and I can look at it. But now my girlfriend texts, I automatically pick up my phone and I'm reading through the text before I even realize what I've done. Okay, so let's think about what's happening there. My attention is becoming biased. My behavior is becoming biased, and even my thoughts in a certain sense, because I may think, I really need to know what she says right now. It's really important. And then all of a sudden I realize, oh my God, I'm reading my phone, and I run into the car in front of me. So pretty much everything from the behavior all the way to your perception and even your memory can get biased by your habits. And that fact alone is a very crucial piece of the science of meditation. And to be honest, it goes all the way back to classical Buddhism, where Buddha talked a lot about habits. I'm not sort of suggesting that science is supporting Buddha directly, but it's supporting the claims that your habits can bias the way that you perceive the world and bias the way that you act in the world. So this is the godfather of modern psychology, William James, who back in the late 1800s wrote this phrase, which is, could the young but realize how soon they will become mere walking bundles of habits, they would give more heed to their conduct while in this plastic state. We are spinning our own fates, good or evil, to never be undone. Now, this is a very interesting quote, because what James is saying is that our habits that we lay down affect us, affect our behavior for the rest of our lives. But there was a little problem. The part underlined is my underline. William James didn't quite understand the concept of neuroplasticity back in the 1800s, as we understand today, which is a basic idea that your brain and your body are constantly undergoing change and learning, based on the inputs and based on what you're doing with your brain. So the more thoughts you have, the more Facebook you engage with, the more, exercise you do, all of that is changing the connections in your body, in your brain, until literally the moment you die. So James was wrong about this, actually. We're always in the plastic state. And the fact that we are always in the plastic state means that everything that we're doing is changing us all the time. And that's essentially where the science of mindfulness sort of enters into this picture. I'm going to pull up the chat here so I can see what you guys are saying if you're chatting at me. Or maybe not, it's not working. So mindfulness enters this picture as a modality for training the brain. So what I mean by that is, if the brain changes based on inputs, one way to think about mindfulness is a way to train that change. You're constantly doing something with your attention, and honestly, you're doing something with your body. You're sitting up straight, you're breathing deeper, you're controlling your breath. All of that is a change relative to being hunched over your computer and reading about the fact that something happened today with the president and what does this mean for the country. So that's a certain input that you're giving yourself. Whereas mindfulness is centering, breathing, letting go. And that's a practice. That's the sort of main idea behind the science of mindfulness. Now, the problem in the science, we could spend hours on this, is that this is a very hard concept to define in the lab. So you can see me here, I'm in my lab. We have lots of ways to measure mindfulness, but what we even mean by that is a huge debate. And really, when we say the word mindfulness, it means a lot of different things. From a form of awareness, so you just practiced a form of awareness, but you just did a mindfulness practice. And also, you can acquire mindfulness as a skill. And then you can say things like you should be mindful, right? You can use it as a word. So it's really, in the lab, the first thing that we try to do is be very clear and precise about what exactly are we studying. Now, typically in the lab, what we are studying is mindfulness as a form of awareness. So we call it mindful awareness. And that form of awareness is present-centered. So you're bringing your attention into the present, and then you're doing that in a certain way. So it's not just focusing, but it's focusing with a bit of decentering to it, or the way John Kabat-Zinn called it was non-judgmentality. So you're not being judgmental to what's happening, you're just noticing, and you're just noticing. And you're kind of noticing in the way of like a scientist, just trying to be objective about things. Now, that's the definition that many scientists have used, but that's got a lot of problems with that definition. What do we mean by being non-judgmental, for example? How do you be non-judgmental, or are there multiple ways to be judgmental? So you can see we can start parsing this pretty quickly. So because of those issues in defining, we have adopted a definition that Shinzen Young has come up with. He's my collaborator in the lab. And the idea here is that that form of awareness that we're talking about, mindful awareness, is really composed of three core constructs, which are equanimity, clarity, and concentration. And when we talk about mindful awareness, we're actually talking about these three skills and the elevation of those skills. And obviously you can have concentration, so you can be able to concentrate on what I'm saying very, very acutely, but you can have no equanimity. So you may be very good at concentrating on me, but then you have an emotion and you get drawn away in that emotion, and then you can concentrate on that emotion. Equanimity would be sort of being open to those experiences, even if they're difficult. So being open to the state of our country at the moment, for example, may be triggering. Having equanimity about that would be noticing that that brings up some fear, and then being present enough with that fear to allow the next sensation to happen. Whereas sensory clarity is really being able to track moment by moment all of these different sensations. And as we did the practice, we were parsing our experience into see, hear, and feel. So you may have noticed that you heard something and felt something at the same time. And if you get really good at focusing your attention, you might start noticing that you can track the rise of the auditory and the rise of the emotional as separate but simultaneous perceptions. You can start tracking the sort of temporal nature of those perceptions. So that's sensory clarity. I like to think about it like a baseball player being able to track a baseball at 90 miles an hour and they can hit a home run. So that's a skill. You can train that skill pretty clearly. But the problem about the whole field is that what we are talking about is very hard to define. And I think you're all practitioners, so you kind of know what I mean by mindful awareness. But when I talk to my colleagues who don't have a meditation practice, they just sort of group it in the same category as yoga or something that Deepak Chopra talks about. And they don't have any idea that it's really these core attention skills, and that these are skills that can actually be trained, just like hitting a baseball is a skill that can be trained. So this is Shinzen. He is my collaborator and somebody that I'm very lucky to get to work with here at the University of Arizona. Most of you have probably heard of Shinzen. He's written a popular book called The Science of Enlightenment. And he's really called for the overlap or the interaction between contemplative practice, so the Buddhist traditions and other Eastern traditions, and Western traditions. There's contemplative practices in Christianity and Judaism. So the sort of bringing the wisdom and knowledge of those traditions into science such that they can interact. And what I mean by that is we can learn from the practice about consciousness, about attention, and maybe emotion regulation and these processes. And then the science can inform the contemplative practice because they're not perfect. And things can happen. So I know some people had some questions about the negative effects of meditation. There are plenty, actually. And you know, if you're wrapped in a contemplative tradition, you may not, the traditions may not have the motivation to be upfront about some of these things. And so science can sort of bring some of this to light in a sort of even way, such that we can see what's really here, what's really going on. And then in my own research, can we ask, can we actually accelerate those practices? So once we understand the mechanism, can we fulfill the Dalai Lama's wish of having a way to make all of this work faster? So that's the kind of big paradigm that Shinzen and I are working on. You can see that he's a very intellectual person. He's logically formalizing basically awakening here. So he's got a YouTube video where you can see him talking about this.
Jay, we had a quick question on chat from Gretchen, and the question is, with children and adults who manage a diagnosis of ADD, ADHD, what challenges have been identified using mindfulness with this developmental delay?
Aha, that's a great question. So that brings up the notion that, well, let's go back here. So we got to be careful about thinking about what are we training, first of all. And that's a big problem in the science. The science has, in the early days of the last 20 years ago, up until 2000, they would just bring meditators in and say, we're studying mindfulness. And they wouldn't actually even define the practice. Now, you folks all know that there's thousands and millions of different practices, and they do different things to you. And so the first question is what are we teaching a kid with ADHD? Now, often what's been taught is mindfulness-based stress reduction, MBSR, which is designed by Kabat-Zinn, this name here. Now, MBSR is a mixture of Vipassana, focus on the breath, with some loving kindness and some yoga and a couple other things. Body scans are in there sometimes. And so what that's really going to teach the kid is enhance concentration, maybe get a little bit of equanimity and maybe a little bit of sensory clarity. But depending on the disorder, so ADHD or maybe even depression or anxiety, focusing on concentration doesn't necessarily make their symptoms go away. And in fact, this is what we're learning from some of the clinical practice, is that if you take a kid with ADHD, or if you take someone with anxiety specifically, or PTSD, traumatic experience, and you teach them to focus on their breath and enhance their focus ability, you can actually make the symptoms worse. You can make the ADHD worse, you can make the anxiety worse. And that sort of makes sense if you're sort of having trouble with emotions and having trouble with anxiety, and then you focus on that, you're amplifying that. And so that's where something like equanimity practice or loving kindness practice might actually be a better fit for those people in that condition. Start there. Once you get the sort of body integration piece worked out or worked on, then you enhance the attention. Then once you enhance the attention, then they can start having insights about whatever's sort of really going on with them. So the clinical practice, unfortunately, the clinical science is extremely messy. It's hard to really say whether these practices work at all for anything except for chronic pain. So if you look at the meta reviews of all the effects of mindfulness-based stress reduction or any other meditation practice on anything clinical, it's really hard to say it works except for chronic pain. Now there's a hint for depression, there's a hint for anxiety, there's a pretty good hint for something like OCD, but way more research needs to be done before I can even tell you you should go do those types of practices for that. So that's where it's at. For ADHD, they've come up with a new practice. I think this is Amishi Jha, but I can't remember which researcher, where they do a mixture of loving kindness and embodiment practices first. And that really seems to help, because an ADHD kid tends to get sort of lost in the sort of mental aspects of their experience, and getting them to focus back on the body kind of sort of quiets that system down a little bit. So good question. Are there any other questions?
Yeah, thank you. We have actually two more questions, and I'll go through. You touched briefly on the negative effects of mindfulness. So we have a question from Christy, which is, what are the negative effects of mindfulness? I think maybe in a succinct way that everybody can kind of wrap their head around might be the way.
Sure. There's two basic concepts. One of them I already talked about. So this comes out of the psychedelic research, and you're probably aware there's all these psychedelic studies going on for treatment, which I think is a beautiful advancement. So there's this phrase called non-specific amplifier. So if I've got anxiety going on and I take a psychedelic, it can amplify that. Non-specific, it's not targeting anything, it's just whatever you got going on is going to get amplified. The same is true for meditation, I think. Especially if you go to a retreat and you just get thrown in the deep end, that's not all good. Most of you who've done retreats, you know, if you're like the normal average person going through a retreat, it's both good and bad. There's challenges that come up, emotional and physical, and things that come up from the past, all of that. So those are the non-specific amplifiers. That stuff comes up, it gets amplified, and without being able to contextualize that, that can be psychologically disruptive. So if you've got some deep issues like trauma or psychological vulnerabilities, we see that happening. If you take a group of people with schizophrenia and don't contextualize mindfulness for them, you can make the issues worse. For the average person, I think it's a little less risky, but you can have certain situations emerging where negative emotions and negative things emerge. And again, if there's not a way to contextualize or integrate that back into the system, what can tend to emerge for people is that they bury that, and then they get really good at focusing their attention. And the phrase for this in the literature is called spiritual bypass. So you are dealing with one piece of your psychology, and the system or the ego is learning how to suppress another piece because it's becoming vulnerable. And spiritual bypass can lead to certain behavioral problems that are only now being looked at in the literature. Then there's all kinds of little things. Some disciplines tell you to sit very still for 45 minutes or more. What we're learning is the obvious, that can be bad, especially if you have an older body. And you know, you have to weigh that against what cognitive effects that you're getting. So there's lots of others we could keep talking about, but we can bring those up at the end.
Okay. And we have a few more questions. So up to you. You want to tackle those now, or do you want to continue? We can kind of get to those in a little bit. One of them is actually contextual.
Sure. Yeah, let's take that one.
Okay. The contextual one is what did you say are more effective alternatives for folks with anxiety and ADHD?
So the basic finding that is emerging is different things work for different people. So different practices will work for you relative to your spouse. That seems so obvious when I say it, but if you know anything about the different traditions, it's a huge debate. Traditions really get stuck on different practices. But what the science is saying is that if we're looking for positive health outcomes, then you need to sample different practices, and then you need to have some clarity about what the effect you're really looking for is. So if you're looking for a reduction in anxiety, then we can give you a sampling of loving kindness, focusing on the breath, body scan, Goenka, and then we can sort of figure out what's working for you, and then you zoom on that path. The basic finding that, you know, is very, very subtly emerging is that body scans and positive affirmation practices like loving kindness tend to work for most people who have anxious thoughts or any kind of trauma that's leading to anxiety. Now that sort of makes sense. If you think about forgiveness practices and therapy, those tend to work pretty well because there's a deep psychological, you know, fundamental psychological issue that's happening. And loving kindness practice really works because you are literally generating positive emotional states over and over. May I be happy, and I'm feeling my happiness. So that's generating that state all over your brain and your body, and the body's learning that. So that, for anxiety might be more important than trying to struggle with the anxious thoughts. Another practice that really works for anxiety is focusing out. So this is something that Shinzen Young has developed. So if you're labeling your mental thoughts, or labeling visual, for example, you can label only visual out. So seeing visual world, that tends to disengage you from this internal loop. And anything that disengages you from that loop is going to cause it to go down over time. Because I'm sorry to tell you, but the more you engage with negative thoughts, negative loops, negative emotions, you're strengthening those connections in your brain and your body. You're literally feeding those neurons. And so anything where you disengage that process is going to essentially starve those neurons for you. So yeah, really good questions. Another big problem that emerges that Willoughby Britton has written quite a bit about, she's from Brown University, is what's called the dark night. Now that's a Christian term that's been applied to Buddhism, but the dark night is essentially, sort of what the existential philosophers were talking about in the early 20th century. It's really sort of confronting the void. So confronting the notion that the sense of self is an illusion, that everything around you is a construction, and that behind it is absolute nothingness. Some people fall into that void, and it's not a good experience. It's like worse than depression, worse than suicidality. So that is occurring for some very, very small percentage of participants who go through, scientific clinical studies. And so that's something as scientists that we have to be upfront about. We can't hide from that. We have to be ethical. And so we're talking about that. We're publishing on it and we're reporting on it. Now I know at certain retreat centers, this happens to people. And typically when a person has a dark night, they are usually sent to the ER. And I'm actually a part of a group of doctors, ER doctors, who are noticing that this is happening more and more, especially since psychedelic revolution is happening. And they're trying to find a way to talk about this. The notion of a spiritual emergency is the phrase that's emerging. Because the doctors don't have a way to say this person has mania and bipolar, and this person is on their path to enlightenment. They're just having a hiccup, a bump in the road that's traditionally defined, and we have ways to map this. So our medicine is starting to talk about this, which is really fascinating to me, actually. And trying to use words like spiritual emergency to talk about it. So let's come back to our little model here. So why does mindfulness work so well? Well, a typical therapy is attempting to just change the input. So instead of picking up your cell phone, you pick up a fake phone. That will cause you to replace your behavior, right? You won't get to this behavior, and that should help you drive your car. Whereas when you practice mindfulness, what we think you're doing is you're actually breaking the link between the craving sensation and the behavior. So if you can break the link between craving and behavior, the supposition or the hypothesis is that this whole thing, so this whole apparatus breaks apart. And I think that that's really where the power of this practice really is. So instead of, if you're just avoiding the input, the whole apparatus, the neural apparatus is still in your brain. It's just waiting for an input, waiting for an input. Whereas if I practice mindfulness and let all of this settle, then the thing has to change. That's what the brain does. And so I think that the picture that's emerging, which Judd Brewer has really beautifully talked about, is that the practice has the power of breaking the connections in the brain, and then it has no choice but to remold itself into a much healthier input-output situation. So that's one thing I wanted to leave you with. I'm going to go a little faster here. The other big piece that's emerging is, obviously we've been scanning people's brains now, looking at how meditation is attempting to change the brain. The take-home message from that science is that we don't really know. All we've been able to do is take people with no meditation and compare them to people with a lot of meditation experience, so 30 years. 50 years, like Shinzen. And what we find is that there's systems in the brain that have changed, that look like they have changed. There's attention systems, there's the body awareness systems, there's regulation of your emotions. So having a negative emotion, realizing that you have a negative emotion, and then saying hello to your negative emotion instead of yelling at your spouse, right? That's emotion regulation. On down to the long-term changes in the sense of self. So how you perceive yourself, how you understand yourself. And this 1, 2, 3, 4 picture is really the state of what we're understanding about how things are changing. And these little brain blobs on the right are all the kind of brain systems that are emerging. Now, the reason that the science is so messy at the moment is because different practices act on different one. So attention, focus on the breath is acting on number 1, whereas body scan in the Goenka tradition is acting on number 2. Emotion regulation is really due to equanimity, I think. I think equanimity is underneath emotion regulation. And so any practices where you're allowing negative emotion to pop up and then allowing it to be there and allowing it to go away, that's going to help you change how you regulate. Now, the change in the perspective on the self, to me, is the most fascinating. And I actually think the thing that's closest to what Buddha was actually trying to argue, which is that there is some core system in the brain, in the body, in your consciousness, that is attaching or averting, it's pushing away, it's wanting or pushing, it's wanting and pushing. There's some mechanism in there that is doing that for the sensory inputs. So, I really want an electric car, right? Because I feel like it's the thing to do because of climate change. So I have this craving, I want an electric car. I go, look at all the electric cars. There's something in me that really wants that. But I really don't want, that electric car. That's stupid and gross. I want this one. There's something in me that's adding value and attaching to things. So over time, when we start looking in the brain and we look at the system that we think is related to that, that system is starting to change dramatically over practice. And it turns out that the more that changes, the more the person is happier, they are satisfied with their life, they sort of shift into what researchers are calling fundamental well-being. And the more you turn that system down, the more fundamental well-being you tend to have. Now we don't have a lot of data on that yet, so I can't say that with any certainty. But that's the interesting picture that's emerging, and I think that goes right down to the first 2 noble truths in Buddhism, that there is suffering and there's a cause to that suffering, which is the system sort of grabbing on and pushing away from everything that's happening. So that's the basic picture that's emerging, but I will have to say that it's very early days in the science, and we have very little understanding of how all this is sort of occurring. There's lots of benefits to this. So what we can say is that as these systems change with meditation, we see all of this. And the science is starting to make that link, that causal link, but it's not clear at this point. But we know if you practice meditation, for example, you'll have improved immune response, you'll reduce your blood pressure, you actually can increase your telomerase activity or telomerase length. So in your DNA, you're actually making it look more healthy, all the way to treating all kinds of different disorders. And the reason that this is happening is because these systems are changing. That's basically all we can say at this point. Now, what we have attempted to do in the lab is try to take people from meditation states. So when you're practicing, you're putting yourself into more mindful awareness, your present moment, non-judgmental. But the point is not to just get to these states, obviously. It's to acquire some type of skill so that you can be happier, you can be a better person, you can, have a better relationship with your family, and ultimately you come to understand who and what you really are. and you're not sort of torturing yourself with all the mental construction. You know, there's all these sort of long-term things that happen during meditation. We call those trait level changes. And Richie Davison, who's a big meditation researcher, has written a really beautiful book called Altered Traits. So it's like altered states, like in psychedelics, but in meditation, it's altered traits. I would suggest go reading that if you're interested. And the basic idea is that the real power of this practice is not really about putting yourself in these altered states, but by putting yourself in the altered state, you're leading to changes in the way that you emotionally react. You're leading to changes in the way that you understand yourself on a fundamental level. You're leading to changes in your overall happiness. You just wake up and things are a little better because, you know, you didn't spend the previous day on Facebook looking at news. You know, you realize that, oh, I need to stop doing that with your meditation, mindful awareness. So those are the trait level changes that we're trying to get people to. And what we think the science can do is perhaps shrink those trait level, shrink the time it takes to go from state to trait. And there's probably multiple ways that we can do that. So one way that I'm really interested is I might be able to give you a psychometric test. And you sort of give me this test. I can say, okay, here's your personality disposition. You're high on neuroticism like me. You are low on emotional control. And because you have these personality traits, I think you should start with Goenka body scan and then move on to a loving kindness and then focus on the breath, right? And the science will then be able to quantify, does that actually help you get to trait level changes faster? So that's a basic paradigm that would obviously be beneficial, I think, to everybody. What we've been doing in the lab, just on the last couple slides, is actually trying to directly target brain areas. We've got two basic systems that we've targeted. I won't talk about them too much, but we're actually targeting them with brain stimulation. Non-invasive, it's safe, we're not doing any damage to the brain, but we're targeting these brain systems that are involved in learning to meditate such that those systems can learn the mindfulness skills faster. And we believe that if that happens, which it's an open scientific question, but if we can do that, we can accelerate the meditation practice dramatically. So instead of taking 30 years, maybe it takes you 5 or 2 to get these long-term changes that we're talking about. So I'll just give you one example really quickly, and then you can ask lots of questions. I'm sure you'll have them. So we're using ultrasound. It's a form of brain stimulation where you can focus energy into the brain and change the brain temporarily. And the basic hypothesis is, can we modulate a part of the brain that would increase equanimity? So if you can come into my lab, whatever state you're in, I can do this brain stimulation and I can downregulate it such that you have a little bit more equanimity. Then what you do is you do the meditation practice while you're in that state. The idea would be we increase equanimity and then you can learn the other skills faster. The whole system changes faster. And then we boost your baseline levels of mindful awareness so that you can take that out into the world and you can use those skills in the everyday world. And as we know, the world is changing very quickly, and I think it's going to continue to change pretty quickly over these next few months. So having those skills out into a world like we have today would obviously be beneficial for people. Now you might be wondering, wait a minute, meditation takes a long time and you're supposed to struggle with it. Yes, we totally agree. We're not trying to replace the practice. And actually, I met the Dalai Lama at the Society for Neuroscience meetings. This is a big science meeting that he was presenting at. I was an undergraduate. I got randomly selected to get to meet him. And at this meeting, the Dalai Lama actually called for what we're working on. He said, if you neuroscientists can figure out what's happening in the brain when the brain changes with meditation, and then give me, the Dalai Lama, a drug to give me those effects without meditation, he said, I will be the first to sign up. And he was very excited about that. It was pretty amazing because this conference has 15,000 brain scientists, neuroscientists. And I swear you could hear a pin drop when he said this. We were all like, oh my God, is he really saying this? because we knew that within the next 50 years, let's just, be conservative, that we will have a technology that will likely do something like that. I'm working on it, Elon Musk is working on it, lots of different people are working on brain stimulation technologies. And although we don't know how to do that right this second, that will happen in the future. And so it was a little tense, actually, when the Dalai Lama said that. But now, what we're doing in the lab is trying to start the first bit of that process. And really, the idea there is not to give you the effects of 30 years of meditation. I don't think we can do that anytime soon. But by modulating the brain while people meditate, we can start uncovering or learning how these brain systems are really involved during meditation. I'm just going to skip this. So just the one area that I'll talk about for the next 5 minutes, and then we'll stop, is an area called the default mode network. This is a very fascinating part of the brain that basically, if you're sitting there and you're not doing a task, so I just tell you to just sit, do nothing. If you start having thoughts, if you start mind wandering, if that little negative voice comes up and tells you that the world's about to end and you whatever, so that's the default mode network, and it's just these little regions right here that show up. It's midline, it's central in the brain, and it's been very well defined. We don't quite understand exactly what it is at this point, but it's one of the most studied brain regions in all of neuroscience. And what we can say is that this has something to do with the sense of self. So that ego process that I was referring to earlier has something to do here. And we know that if you put meditators in the MRI and you tell them to meditate, you get down activation of the default mode network. The more meditation experience you have, the more it's turning off. Now that's super fascinating because it sort of matches exactly probably with your experience. The more that you just pay attention and you get out of this loop inside, the more you're in the sensory world, the more you're just sort of paying attention. One thing that we've also found is that if you give someone a psychedelic, so let's say psilocybin, magic mushrooms, if they have what's called an ego dissolution or an ego death, which happens in the clinic when you're trying to get people clinical effects. So if you give people a pretty big dose, look at what happens. So this is the meditation region going down in the default mode network. That's the same region that goes down when you take a pretty big dose of a psychedelic. Now, what's really important about that in the clinic, if you're looking at the intensity of that experience and you're mapping the intensity of the experience onto positive health outcomes. So these are people with depression or PTSD. And you ask, okay, how intense was your ego death? This person out here is having a complete merging with the universe. I mean, the ego is an illusion. They go through that, the ego dies, which is probably a little terrifying, and now they are one. They are having what's called a mystical unification, an oceanic oneness with the universe. Very interesting and positive experience for most people. If you get people there, you see a bigger decrease in the default mode network, and the intensity of that decrease predicts how happy they are 4 months later. Okay, so there's something really important about decreasing this in terms of getting people to those health outcomes. Now, if you look at meditators, long-term meditators, that's exactly what's happening. The other piece is if you look at people who have depression, anxiety, lots of inner talk that's negative, guess what happens? This red region becomes more red, right? The default mode network is turning up. And the more you turn it up, the more it correlates with negative health outcomes. And so I don't want to say that we just want to turn it off. You need your default mode network, obviously, but you don't need to have it engaged 100% of the time, right? And what we're finding is that if you can downregulate it like these psychedelic studies, actually that can lead to positive health outcomes. So that's essentially what we've been doing in the lab. Is we've been asking if we can inhibit the default mode network with brain stimulation, brain inhibition, does that actually increase equanimity on a moment-by-moment basis?
Jay,
And,
sorry if I just interrupt you just for one moment. Just, so they'd like to have a little bit of clarification around equanimity and what exactly does that mean in the context that you're explaining?
Sure. So the basic definition of equanimity we use is an attitude of openness and acceptance. So you can focus your attention on a percept, on an object, and then you can be open to it. You can accept whatever it is. So Donald Trump has coronavirus. Scary, may make you feel a certain way. Equanimity would be noticing whatever emotion I just brought up for you and just being present with it, not judging it, not letting it lead you down the path of, oh my God, the country's falling apart, I need to go in the streets. That may be true and that's valid, but just noticing, being open and accepting. And so the traditional definition is being open and accepting to whatever is occurring. And that whatever could be negative, it could be pain, it could be, whatever it is. And so it seems like this attitude of openness and acceptance is a fundamental component of mindfulness, actually. We typically define it as attention, but attention is just a piece. It's the equanimity piece as well. Does that help, or do we want an example?
Yeah, I think Mariana Levy, Mariana, if you have a question, would you like to, is that clear as far as equanimity? I'm sure others might have the same question.
Sure, so I can give you a quick example. Let's say you get in a fight with your spouse and they say something to you that really hurts your feelings. So you might be like me, where you just automatically respond back out of frustration or protection, and you hurt that person back. Equanimity would be, they say something that hurts your feelings, you notice, you accept, you're open to this feeling of hurt, and then you let go, bring your attention back to the present moment so you can continue to pay attention to what they are saying. Because your ultimate goal is to have a connection with your spouse. You're not trying to protect yourself, really. You want to have that connection. So equanimity is just noticing, letting it go, bringing your attention back.
I just wanted to say that to me, equanimity, that sounds more like detachment and not really equanimity. Mm-hmm. So, sure. So sometimes you notice something and you notice what is causing you, and you have a clearer picture inside, but it doesn't mean that that you're detached. You are actually you are acceptant on your feelings more than going back to neutral, which is what it seems more like detachment. So that's when you describe it, it doesn't sound like equanimity, which comes more out of wisdom than a reaction from just concentrating on your breathing. That's what I was saying.
You could enter yourself right into the scientific debate, because what you just described is actually, any definition of equanimity has to distinguish between detachment and equanimity. So I gave you a very, very general definition, but you're absolutely right. And this becomes exceptionally hard to measure. How do you measure what you describe, which I think you're right. You're talking about true equanimity, which is holding into that space with a flavor of a certain attitude. Wisdom is even harder for me to define in the lab, but I think you're right. But at least saying, a certain way of holding your attention. But then it needs to both distinguish between detachment and also apathy as the other dimension, where we've got a lot of people in the clinic who look like they have equanimity, but they actually have apathy. And so it's this tripartite separation. But right, you could come to my lab and help me figure that out, please. Okay, so I think we can stop and just take more questions, because I'd rather discuss than continue going here. So basically, this is where we are. We are trying to enhance equanimity and really digging into these problems that that Marina is talking about, actually. So we are ongoing right now. We are taking meditators in the lab. We are stimulating their brains and trying to figure out if we can operationalize and define things like equanimity and mindfulness. So what other questions?
There's a common theme on some of the questions on chat, and that's going back to you briefly talked about mindfulness chronic pain as we were talking about ADHD and ADD, and folks are wondering if you could maybe just get a little bit more in depth about mindfulness chronic pain.
Sure, in terms of sort of what we know about it working.
Yeah, exactly. Maybe a little more. Than folks can feel free to clarify and raise their hands and ask further questions if they want to on chat.
Sure. So most of the review papers, they look across different studies, and as you know in science, if you want to get a good picture, you can't just look at one study. You got to look at the big body of evidence. So when you look at the body of evidence, it looks like mindfulness practices work reliably for chronic pain. Now, there's a lot of reasons for that. I think part of it is chronic pain is an easier thing to define. So as we were just digging into, the way you define these things is fundamental to how you measure them. And if you have the wrong definition, your measurements are going to be fuzzy. And that's mindfulness science as fuzzy as anything right now. So chronic pain is a clear target for measuring. You can measure it go down or up, even if it's subjective. So I think that's part of why we're getting a clear signal. The other reason is the practices work really quickly for helping you stay with the pain. So what we were talking about with equanimity, if you can truly learn that, okay, this isn't going to go away, but I can relate to it different. And it's that relationship to the experience that becomes very powerful for patients. That seems to, for whatever reason, be a quicker insight for chronic pain than it is for traumatic experience or depression or something like that. And actually in depression, people ultimately learn that, but the depression doesn't go away. So mindfulness doesn't cure depression in any sense. It allows you to live with it, essentially to have more equanimity with it. So that's basically all we can say, is that the signal is greater for chronic pain than anything else. The other reason for that is Jon Kabat-Zinn originally developed mindfulness-based stress reduction, MBSR, for chronic pain. And so it also may be the case that that's just what we started studying first. And so we've had basically 40 years to develop the science. Whereas applying it to ADHD, that's new within the last 5 to 10 years, to be honest. And so it's just maybe too new of a science.
And then we have one other question we have, folks are asking, is if your study is still open to taking participants, and how would they, is there a mechanism or a way to contact you to be part of that study if possible?
At the moment, we are doing studies on undergraduates at the university. That's partly because of COVID. My lab was really, we had lots of funding coming in March of 2020, and everything was being put into my account, and then the shutdown happened. So, that we had to take a pause for a while. And so now we're trying to figure out how to safely collect data in the time of COVID. And because of that, we're taking healthy undergraduates because they're less likely to have problems if they do get infected. The other reason for that is, like I said, all of this is so hard to define. So how we define equanimity, how we define the brain regions. And because of that, we're actually starting with non-meditators, and we're trying to basically induce the state and then see if we can measure it. So that's the basic science. If that works, then the next step is a 2-month meditation protocol, which will start in probably the fall of 2021. And that one will be open to the public. So you can look at my website. I can put that in the chat. You can just check back in 2021, and hopefully there's a vaccine and everything is fine, and we can get back to doing the studies.
Jay, I think Macy, your hand is up. Do you have a question?
We can't hear you if you do.
Okay, yes, I do have 2 questions. One being around what you described earlier as the Dalai Lama's desire for the acceleration of mindfulness. And I'm curious how that actually aligns with the concept of beginner's mind and beginning again and again in every moment. And my second question has to do with there was a workshop that you had presented in Montana, in Gallatin area, and was curious sort of about that workshop. And with the work that you're doing, are there like randomized control trials, and sort of what is the intention, the greater intention behind this device and the work that you do in the lab?
Great questions. Yeah, so the workshop that we gave was actually using light to stimulate the brain. So you can use near infrared light to increase mitochondrial energy. And I think that that's one way to boost the practice. That's a still open technology. We're not quite sure how that works. But the much larger agenda of the lab is to understand how is mindfulness changing the brain, and can we quantify that? We still don't really know. But if we can quantify it, as I was saying, we can build systems that help people learn mindfulness faster. So that's kind of that agenda. The much larger agenda is to find a safe technology to help people acquire the mindfulness skills much faster, such that the world can get on with being the world plus mindfulness skills. Because we believe that that's a world that will, get on to solving some of these big issues that we really have going on. And so we have a large and grandiose vision in the lab of having a very cheap, hopefully, a technology that's anybody can buy or anybody can get their hands on. It's freely available, and it's safe enough to give them basically a taste of the practice, so they keep going and they can acquire these skills. But the basic science is happening now, and I think it's going to take a very long time before we even know if this is possible.
Thank you, Jay. And I also wanted to add to that, because we're all coming together here and practicing together, this might seem as something like, why would we want to do that? But there's a lot of people in the world that can benefit from this work and just cannot really sit and meditate, whether they have some kind of diagnosis, mental diagnosis. So this could aid to all those people to also reap the benefits of mindfulness. And the research behind is kind of allowing us to see a little more of what's possible. And also the areas in which might not be possible. We have to keep an open mind with these things and seeing the things that work and the things that might not work. Where can we apply this incredible resource that we have? So Mariana, you have a question as well? I see your hand. Oh.
I saw that she asked a question.
Hi,
Yeah.
Jay, again. I was reading on your research before I came into, and also some of the systematic reviews. It does say that this is unproven technology and that the safety is not well established. And that really worries me a little because, this is not science yet. Maybe eventually it will be, but not yet, right?
Well, it is science in the sense we're doing experiments and trying to find the answer.
Yes.
Whether it's established, I think,
right.
Is what you mean. So that paper, I'm not sure which exact one you're talking about.
Systematic review that came out last year I can give you the quote.
I think I know the one. I think like 6 or 7 of them came out, so there's a couple.
Last year, hold on, I'll tell you right now. It's called, just one second, I have it here.
So what I can say about that is what they're talking about is both acute effects. So we're putting energy into the brain, and you always have to be careful. Then there's the question of long-term safety. So what are the effects over time? And if it's the papers I'm thinking about, they're talking more about long-term effects.
Actually, it says called Safety of Transcranial Focus Ultrasound Stimulation, a Systematic Review and State of Knowledge from both human and animal studies. It came in brain stimulation in December of 2019. That's the one I'm quoting.
That's the one. Yeah, so I'm very familiar with that. They've cited some of our work as well. So we are using low intensity ultrasound, which has been obviously used for 80 years. Pretty much everyone on this call has received low intensity ultrasound when they were a fetus. So we know quite a bit about bioeffects for low intensity. We also know if I crank the juice up, I can burn tissue pretty clearly. So those types of safety questions, we have a lot of evidence on. So we're pretty clear that it's not going to like heat and melt the brain at low intensity. But how this is changing the brain, you know, that's still a large question that is unanswered. And so what we typically do is we're below the FDA limit for energy. So it's 720 milliwatts per centimeter square. And then the ultrasound's pulsed on and off very briefly. So this is, in our lab, it's actually less overall energy than a fetus is receiving. But then we're focusing it, so there's that question, which is the big safety question. But then there's also the question of if I did this multiple times. We have no evidence. Well, my lab has one study, basically. We're the only ones who published on that. And we did 5 days on depression. That seemed to be totally safe. Depressed people had less anxiety. But, you know, if we talked about doing this for 20 times over a retreat, we would just have no evidence to know about the long-term safety. But the science is pretty, you know, what we can do is make predictions, and the science is pretty clear that it would probably be safe. But with anything, you know, I mean, I would say before Facebook came out, we had no scientific evidence of how it would change your brain, and now we know. So, you know, once you have that evidence, you sort of tune how you're using those systems. And we think about brain stimulation in the same way. It's a stimulus that you're putting in. As long as you're not doing any damage, then you have to think about how are you using that system? How are you using the brain once you've put the stimulus in? And so for us, that's why we always couple with either meditation or we couple with therapy. Because if you just did this without any intervention, you know, you could just change the brain in sort of different ways and you wouldn't actually know how that brain's changing.
Thank you.
Good question, though.
Thank you, Jay. And I think that's also. Oh, yeah.
Sorry. Go ahead. I was going to get to the next question, but if you're.
Yeah. No. Go ahead. Go ahead. Yeah.
Sorry. Richard has asked a couple of times on the chat, so I wanted to make sure I got to it. And his question was around emotional dysregulation and how that works with equanimity as a way to stay present, especially with chronic pain or something like that.
Yeah, great question. That's something that has been written about in review papers, but nobody has directly studied that yet, so it's hard to say. The assumption is that equanimity is helping you to return back to baseline. So this gets back to that question that Marina was asking. So if you look in the physiology, it does seem like meditation, like once you have an emotional response, you return quicker back to a physiological baseline. So that might be one reason. It's just not happening so far out. The other idea is that it's actually helping you to process that information in a way that's behavior oriented versus like just getting caught up in the negative emotions. So this is something that cognitive behavior therapy tries to teach, is you become aware that you're being triggered and then you become aware of what you're doing after that. But like I said, nobody's really been able to study that yet.
And if I may add to that, Richard, I think we've talked about, we've discussed this, both of us as well in private, but also it's not that mindfulness is a pill for fixing it all, but what you could do on chronic pain is it changes our relationship to circumstances, to the event. So whether it's chronic pain or anything else, we can now relate to it differently. And I think that's what I'm getting from actually a little bit of the talk here as well, is that the more we relate to things differently, the more we create different habits in the brain. Mm-hmm. So the more we connect the brain in different ways. And so, you know, and I always make sure that I say that in my classes. It's not like, you know, you come to MBSR for pain, it's not going to take your pain away, but it will change the way you relate to it. And hopefully, yes, maybe lower the intensity in that way. The more we focus on something, the more intense it becomes. And just like we were saying, if we have a lot of anxiety, a lot of thinking going on, if we're focusing on that thinking, well, it's not going to work for us. But maybe if we focus on the sensation in the body, that might be helpful. And so it's really about finding this fine attunement in the practice and seeing what works, what doesn't. And, you know, when we practice all the different modalities. We practice body scans and breath and emotions. And then from there, we can see what works for us individually. And that could be really helpful to know. It's not just like one thing, one practice will work for all. And so we just learn what works and what might be beneficial as well. But yeah.
Yep, that's exactly right. And part of what I didn't get to show, but we're trying to create a quantification of the subjective experience of the patient or the subject. So Shinzen has this thing he calls the happiness grid. It's the periodic table of happiness elements. And when you ask, you know, what's the goal of mindfulness or meditation, you'll get a billion different answers. But the way that we think about it is sort of deep and broad levels of happiness, defined culturally. These are defined in different ways. But the Greeks have this term eudaimonia, which is a sort of deep and broad level of defining happiness across different categories. And so one thing that we're attempting to do in addressing this issue of safety and how the person is changing, even independent of brain stimulation, is, you know, have this defined for them and then have them sort of able to report in so that we can make sure that they are moving in a direction that seems appropriate for them, for their goals, for their social situation. You know, everything is sort of, you're a human body embodied in a social, political, you know, situation. And so we don't want to, you know, zap you into hyper attentive abilities without having any connection to your body or your emotion. You know, in my mind, that would be a very bad outcome and dangerous in a way that, you know, we're bringing up. And so, right, you know, as we develop our tools, we have to be very sensitive about what are the actual outcomes. And is the patient able to even report it? You know, what are the people around them saying? So this is kind of multi-tiered, multi-structured in terms of what actually needs to be built. And I think that those types of tools are needed for technology in general. So I don't think just for brain stimulation, but I keep picking on Facebook for a reason, because I think it's having a huge negative impact on people's mental health and our democracy. And so having these meta tools to help us understand, like, how is the technology shaping the human being is something that my lab is working on and many other labs are trying to work on. And we want that to get out as well. Because if I don't create this technology, Elon Musk is, and he's not talking about these things. So, you know, I think we in the contemplative communities need to push this much larger narrative that it's not just focused attention, it's how the human being is changing, you know, over time.
Thank you so much, Jay. I know there's a couple more questions. We're not going to be able to get to everybody. Unfortunately, we're out of time. But thank you so much for being here and for shedding some light in all this, and for also your enthusiasm in bringing responsibility to how we use technology in the future. Because if you don't do it, somebody else is going to do it, and they might not be as responsible. And so, as you said, so really, really grateful to have you here and to really give us a lot to think about, and for sharing everything that's out there right now that it's important to know for us as well. So, yeah.
Well, thanks so much for the great questions and for practicing with me. And maybe we can come back and do this again once the science develops a little bit. I would love to. And I would love to come back and just practice with you guys. So if I'm invited, I'll show up next time.
You're more than invited. You're more than welcome to our group. Thank you so much.
Thank you.
Thank you. Thank you, everybody, for being here.